Today we are pleased to host a discussion surrounding vaping and Bill S5. Experts from all sides have an opinion, and we would like to discuss whether it is a cause for harm or a valuable tool to be used for harm reduction. And I'd like to take a moment to thank the Canadian Vaping Association for making today possible and sponsoring this session. Please join me in giving them a hearty round of applause. Now, ladies and gentlemen, without further ado, it is my pleasure to turn the podium over to a good friend of the club's, Mr. Mark Keeley, Chief Advocate, Keeley & Associates, who will officially get things started.
Thanks, Natasha. I want to welcome everybody here. This is, in a word, this is outstanding. When you can get vapors in a room and behave, this is an extraordinary event. So I'm really proud of that. And Michael, I want to give you a tremendous shout out. Not only Michael Purley and I we sit on Smoke Free Ontario campaign cabinet years ago, but the fact that you're actually here and you're behaving is actually a good thing too. I have the honor of introducing our moderator for today, who will kick things off for this. And I've known Lisa for a long, long time. Lisa I got to meet Lisa through her husband, Warren Kinsella, who's also here. Warren is a great friend of mine, but more importantly, a great friend of this country's. We're really fortunate to have this august panel that you're going to moderate today, Lisa. And if I could hearken back to the choice of words of outstanding, I think not only do we have an outstanding panel, we have an outstanding moderator. If you ever have cause to watch television and look at those who are astute observers on issues related to Aboriginal affairs, you'll always see Lisa on TV. If you're looking at things like environment or healthcare and you're watching television and you want an expert opinion and you watch television, you'll always see Lisa. So we're really fortunate, Lisa, to have you in your role today to moderate this panel. And the fact that everybody is well behaved for you today is a good sign. So without further ado, I'd like to introduce to you Lisa Kinsella, who's our moderator for today.
While I appreciate that everyone is so far well behaved, I'm expecting that that may not continue much longer. I've been in politics a very long time, so I do know how to handle that when things tend to go awry. So thank you, Mark, very much for that kind introduction, and good afternoon, everyone. It's so nice to see you all here today, and I look forward very much to today's panel discussion as we talk about issues surrounding vaping as legislation is currently being discussed on Parliament Hill. So thank you again to Natasha Moreno and the Economic Club of Canada. Thank you to the Canadian Vaping Association for hosting what is going to be a very honest and very real conversation about vaping as we move forward with federal legislation. As you know, we're having this conversation because the government is making changes to the Tobacco Act and has now given vaping a category under Bill S5. And this is one of the most controversial pieces of legislation in recent years, which is why we wanted to put this panel together today. Currently in the Senate, the bill sets out vaping regulation, and the bill has been referred to the Standing Committee on Social Affairs, Science and Technology, which just released its most recent report last week. Proponents of vaping, of the legislation, say that vaping is a positive alternative to the dangers of smoking and that it will help cigarette smokers quit. However, there are critics who believe that vaping is dangerous and should be regulated like cigarettes. So while the Government of Canada is considering Bill S5 in the coming months, experts today from all sides have come together to talk about whether or not vaping is a cause for harm or a cause for harm reduction. Because I'm sure we'll have less time than we would like for such an important discussion, I want to explain how we'll proceed to ensure that every viewpoint is heard here today. I've come prepared with 4 very big questions that will be directed to each of our 4 esteemed panelists. We'll have about 12 minutes for each question, and I really want to have a free-flow exchange of ideas. I'll direct each question specifically to one of the gentlemen on the panel first, and then we'll open it up for discussion and debate. With that kind of housekeeping out of the way, I'd like to introduce our 4 panelists for this afternoon, whose very diverse experiences and accomplishments may answer some questions and raise some new ones about vaping. Our first panelist is Arthur Potts, the Member of Parliament, Provincial Parliament for Beaches East York, which he has been since 2014. I'm very proud to say that he is my and my husband's MPP, and also my daughter's and her husband's MPP. So you have a good Liberal family there. Arthur has played an instrumental role within the Ontario government in just a few years that he's been there. He has facilitated a $50 million donation to the Toronto East General Hospital, which is now called the Michael Garron Hospital, and he helped end the practice of charging non-refundable waiting list fees to parents who are trying to access childcare. These are just 2 examples of his many notable achievements. He is also the parliamentary assistant to the Minister of the Environment and Climate Change. Arthur works toward a more sustainable Ontario while generating opportunities for our province's green technology industry. And in 2016, which brings us to why Arthur is here with us today, he supported his constituents' rights to harm reduction and presented a petition signed by thousands of Ontarians asking that the provincial government further amend its position on the proposed e-cigarette regulations to reflect the rights of Canadians to harm reduction as noted in the Canadian Charter. Thank you for that, Arthur, and thank you for being here. We'll wait and we'll bring you all up. Our next panelist is Doug Elliott. Doug is a partner in Cambridge LLP and is renowned for his work on landmark constitutional cases, such as same-sex marriage. Doug is also a leader in the field of class actions, as he won the largest Canadian class action trial judgment brought by gay and lesbian Canadians seeking CPP survivors' pensions. Among Doug's other notable successes, including playing a key role with the National Hepatitis C team, which secured one of the largest settlements in Canadian class action history. In addition to numerous awards for his social justice work, Doug has been recognized as a leading expert on public law and is one of the best class action lawyers in Canada. Thank you for being here, Doug. Our third panelist is Dr. Mark Tyndall, the Executive Medical Director of the BC Centre for Disease Control and professor at the UBC School of Population and Public Health. He also serves as Deputy Provincial Health Officer for British Columbia. From 1999 to 2010, he was the Program Director for Epidemiology at the BC Centre for Excellence in HIV/AIDS and was co-lead investigator on the evaluation of Insight, North America's first supervised injection site. Mark is a strong advocate and leader for public health in Canada and has fostered multiple community-based collaborations that have led to many health policy changes, along with 220 peer-reviewed publications focusing on HIV care and prevention, drug use, and public health intervention research. Thank you for being here, Mark. Our final panelist is Michael Purley, the director of the Ontario Campaign for Action on Tobacco, where on behalf of the Ontario medical and public health communities, he led the campaign's efforts to help pass the 1994 Ontario Tobacco Control Act, which made tobacco sales to minors illegal and banned the sale of tobacco industry products in pharmacies and vending machines. Following this, Michael led and worked with campaigns in support of a smoke-free workplace and public place bylaws and legislation in multiple provinces, including the 2004-2005 campaign that passed legislation mandating 100% smoke-free workplaces and public places and a ban on retail displays of tobacco industry products province-wide, along with the 2009 ban on smoking in cars transporting children. His recent work has contributed to the implementation of Supporting Smoke-Free Ontario by Reducing Contraband Tobacco Act and the 2015 Ontario Making Healthier Choices Act that banned flavored tobacco and regulated the use of sale of e-cigarettes. Thank you very much for being here, Michael. I invite all the panelists to come now to the stage, and we can get started on talking about vaping and the questions surrounding whether it is a cause for harm or a valuable tool for harm reduction. Thank you.
Testing 1, 2, 3.
Is everybody comfortable? Excellent. So as I mentioned, I'm going to go through the questions, which are quite lengthy, so you have context and background. I will ask specifically one member of the panel to lead off, and then once he finishes, anyone is welcome to jump in. I'll be keeping an eye on the time just to make sure we don't go over. So my first question is about protecting children from vaping. Canada has been a leader in creating legislation that keeps the younger generation in mind. Ontario specifically has worked to implement Smoke-Free Ontario, designed to protect children and youth from the dangers of smoking. Smoke-Free Ontario legislation was enacted to help smokers quit, protect people from exposure to secondhand smoke, and encourage young people to never start. Measures in place to protect children include banning smoking in childcare facilities, in motor vehicles with children inside, multi-unit residence, on school property, and on children's playgrounds and publicly owned sports fields. Our own federal health minister, Dr. Jane Philpott, stated, "The prevalence of several products, including in particular vaping products and their use, is growing rapidly. These are less harmful than tobacco products, and they have the potential to bring about public health benefits if they reduce tobacco-related death and disease. However, they also have the potential to bring about harms if they entice youth and non-users of tobacco to develop a nicotine addiction or lead to tobacco use." End quote. These measures all work to limit the amount of exposure children must limit the amount of exposure to denormalize the act of smoking and deter them from ever taking it up. Vaping is different from smoking, but still involves nicotine. How do we ensure that our children are kept away from vaping and vaping products? Michael, would you like to start us off? Oh, God. See, okay. Easy questions.
Yeah. Well, thank you. I'm glad we're here, and I'm glad we're having this discussion. Mark and I already got into it before we started, which is great. I think the way we come at it as the Ontario Medical Association, Cancer Society, Heart and Stroke, and Non-Smokers' Rights is the fundamental problem here being nicotine and how nicotine is delivered to people who become addicted to it. And the tobacco industry, there's a famous quote from 1965 from an executive in the U.S. industry. "We are then in the basis of selling nicotine, an addictive drug effective in the release of stress mechanisms." So they've known for years about nicotine's addictiveness, and the cigarette is really a dirty drug delivery system. It's a drug delivery system that has toxic components. So the question is, and the debate we're going to have today is, what kind of alternative nicotine delivery systems to the cigarette should those trying to quit be able to use, be encouraged to use, have easy access to use, and how should the rest of the population be protected, and specifically about young people. Contrary to popular belief, and I never hear anybody say anything different than this, it is not kids who start smoking these days. People don't start smoking as under 18s these days the way they used to. It used to be the rule of thumb, 19 times out of 20, you would start smoking before the age of 20. Now, initiation has shifted way upward to the 18 to 30 cohort of young adults. Right now in Ontario, smoking prevalence in grades 7 to 9 is unmeasurable. It's so low. And between grades 7 and 12, it's at 9%. So there are very, very few young smokers. My feeling and our feeling is we don't need, given the number of other tried and true, if you like, and evidence-based cessation therapies For the small group of young smokers that try to quit, I don't think we need vaping products for them to do so. We don't need them to have access to them. Given the number of experimenters that we do know are out there, they experiment with e-cigarettes because they're not cigarettes. Some of them experiment with product without nicotine. Others experiment with nicotine. There's very good research showing that smoking as little as a pack a day, or 1 pack of cigarettes in a day, can addict a teenager to nicotine long term. So we don't want any kids under 19 exposed to nicotine and the possibility of becoming addicted to nicotine itself and then perhaps moving on to other products. I know there are those who will say there's no evidence to indicate that that is actually happening. There is not any strong evidence to show a big movement, that's true. There is some evidence indicating this possibility. We need to be very careful about it, so we totally support a ban on access to vaping products by kids under 19. And regarding vaping products without nicotine, well, there's no reason for them to use them. And they can be modeling smoking behavior and the possibility of moving on to tobacco products. Vast majority won't, but some might.
Thank you. Would anyone else like to jump in?
Sure, I'll jump in. Lisa, thanks very much. Great to be here, actually. I was part of assisting with the Economic Club over 10 years ago when they first got off the ground and helped bring in sponsors. And never in my wildest dreams did I believe that I'd be on a panel. And it's one of the great benefits of being elected, I suppose. Accidentally elected, as the case may have been. That's another story. Totally agree, actually, where we are in the great work that has been done at Smoke-Free Ontario, that the one piece of the Making Healthier Choices Act that is actually in effect right now is the one that bans access to 19-year-old kids 19 and under. And so that as a gateway drug thinking is very much part and parcel of why that was into effect. Kind of interesting why I'm here, because, you know, it's a parliamentary assistant to environment climate change, really not my file. But when we were going through Healthier Choices Act and we were getting a lot of pushback from the industry about the direction we were going, because it looked like we were putting all vaping in the same category, absolutely in the same, treating it the same way as cigarettes. And the pushback was great, and, you know, hats off to the industry. You know, you got our attention. And getting our attention, Maria, e-cig Flavorium is her store, Beecher product. And I was getting those emails and hearing very strongly from others and on Facebook groups, you know. So I called up Maria and said, we want to meet. And so came down, met all these adults who had stopped smoking, had lost weight, who are now running marathons, something they never thought they could do before because of this product line. And so it threw a caution to me that said, wow, you know, I didn't know anything about vaping at the time. Maybe we should be taking a different look at this as a different kind of product, and brought that message back into caucus. And so we were able to put on hold some of the other things while we study it further. So the ban on children, absolutely essential, and it's a good place to start.
Well, it's interesting. When I was young, we used to vape all the time. When you had a cold like I do now, it was called a Vicks vaporizer. And it actually was considered a healthy thing. And if you look at some of the legislation that's been proposed by the anti-vaping opponents, my mother would have been hauled off to the Huskow in moments because she was supplying a vaping product to her underage children. They're still on the shelves, by the way. I noticed the other day. I think that's really the point. What is in the vapor is a big part of it. I agree that children need to be protected from nicotine, although, again, when I was in high school, the kids who were interested in smoking, I wasn't one of them, didn't have any trouble getting access to tobacco and other products that were more illegal that they wanted to smoke. And it is kind of ironic now that we're, as a country, about to move in a direction of legalizing sales of marijuana at the same time that we're seeing, you know, this hugely draconian legislation in Quebec, rather more sensible legislation at the federal level, but imperfect. And fortunately, the Ontario legislation, a lot of the bad bits have been held back. But I, for one, have no problem with restricting sale of vaping products to minors because it can be used for nicotine delivery. A lot of the people who vape do use it for nicotine delivery. I think that's just the reality of the situation. But I will say that I don't buy the modeling argument at all. To me, this it smacks of Nancy Reagan and just saying no. Like, I don't think that we should not make policy decisions based on a kind of temperance model of what bad things might happen. I think the Supreme Court has made that very clear in the Insight decision, that what people like Mr. Potts ought to be doing is making policy choices based on science and not based on speculation.
I think I'll save most of my comments for something I'm more comfortable with talking about. I can't see anybody thinking that we want to put kids in harm's way and get children addicted to nicotine. I think, though, that our experience with other substances, that putting a 19 restriction on it's not going to make a huge amount of difference in the long run. So it's fine to do it. I have no issue with not selling it to youth. But I would say the only other thing that I would point to with youth is probably the biggest influence of younger people taking up smoking is their environment and who they're around, their parents, uncles, aunts, brothers, sisters, and I think it's a huge positive statement if those influencers vape. And so I think that's the kind of modeling that could be very helpful. And if we're actually interested in reducing smoking among young people, I think get their parents to stop smoking would be one of the best things we could do. So I think vaping for children should be looked at in that angle also. I think there's ample evidence that vaping rates, at least experimentation, have gone up very high among youth in the last 2 or 3 years, but that's with a mere decrease in people smoking. So if we have to switch off, I would prefer those 10 or 15% of youth who are trying experimenting with tobacco or vaping. They should probably be experimenting with vaping products rather than cigarettes. And the graphs are exactly the same. The CDC shows that in big studies in the U.S. that cigarette smoking has gone down and vaping's gone up, and the level's about the same. So I think all we're doing is switching off kids who would be trying smoking anyways. So and it's probably a positive thing in that regard. So.
Thank you. Of course.
I want to ask the audience a question. How many people are there in the audience who smoked, who tried to quit by all other means, and only were they able to quit by vaping? Okay. I think what you did is very well supported by the science to date, because the science to date, as shown in a Public Health Ontario report that was just released earlier this week and has a section on e-cigarettes, says, in essence, only those who want to quit should use e-cigarettes, vaping products. And there's no reason for kids to use them. And they shouldn't be co-used. And we might get in, Mark and I had a discussion earlier about using cigarettes at the same time as using vaping products with nicotine. He says, look, if that gets you down to 5 cigarettes a day from 20 plus vaping, isn't that better? The problem is the data that we do have shows that in the longer run, those efforts, depending on co-use, cigarettes and vaping products, don't work out, and the people return to smoking. So I think what we're very interested in is seeing space made for the use of these products for people, especially those who've tried everything else and it hasn't worked. Well, how do we transition to a non-tobacco nicotine delivery system? And this assumes most of you probably used the gum, the patch, maybe the inhaler. They didn't work. So you move to vaping products, and it did work. And there's got to be space made for that population in particular. So.
And I'm not sure why we have to go the whole gamut of other uses first. I mean, why wouldn't you just go with the one that you're anecdotally is hearing is having the most success? A lot of people object to using a patch or the gum. They don't like the taste. They don't like the idea that they're putting something through a patch into their. So, I don't think it's the end of the run. It's just, it should be an available opportunity. Go back to this whole question of science. We don't have great science on what's the effect, the long-term effect. We don't know whether a population of vapors are going to end up with oral cancers that we didn't imagine before. We don't know. And we're doing that research. And I'm pleased to say that the feds are helping fund, and the province of Ontario is doing some significant research on the best they can on longer-term impacts and getting a better sense. So we also know that anything we ingest, from broccoli to alcohol, there has to be a food safety, a drug safety, whether it's a homeopathic medicines and such. You need to have it regulated. We need to know what's in it. We need to keep people safe from harm. And so, there's going to be a role, I think, from the federal side for regulating vaping products so that you can be assured of where they're coming from, what's in them, and that you're not, having fentanyl put into them or something. We just don't, it has to be regulated.
Yeah, and I'd just add one quick factual item. The federal approach allows for recreational products to be approved via the Act, therapeutic products to be approved via the Food and Drug Act. So they're two separate streams depending on how people want to use them that are allowed for in the federal bill.
Thank you. One of the things I wanted to go back to was something that Mark had mentioned, and that was modeling and how children are taking up smoking. So Senator Mark Gold was quoted on March 9th, and he was speaking to the benefits of vaping. And what he said was, we don't have a large body of long-term studies of evidence of the long-term health effects of vaping, not on the efficacy of vaping as a means of stopping smoking tobacco products, but that doesn't mean that we don't have no evidence. I'm not talking here about anecdotal evidence, although it is quite abundant. He goes on to say that, like himself, his son started smoking at an early age, well before he was 18. He said 3 years ago, his son started vaping and has not smoked a single cigarette since. He also gradually lowered the nicotine levels in the liquid down to a minimal quantity. The senator goes on to say that his wife smoked for nearly 35 years, but ever since she started vaping 2 years ago, she has not smoked any cigarettes. She uses a higher level of nicotine, but she doesn't smoke anymore. Senator concludes by saying, vaping may not be 100% without some risk to health, but I do believe that the evidence does establish that it is less harmful than smoking tobacco. Let us not the best be the enemy of the good. So my question is this: based on the growing number of instances, as we've seen with people's hands raised, where vaping has served a benefit to long-term smokers, including family members of my own, and Mark Gold's personal story, is it fair to say that vaping presents unprecedented opportunities for harm reduction and perhaps even for smoking cessation? So I'm going to turn that over to Arthur to start the discussion off. Do you believe that vaping presents opportunities for harm reduction?
Well, like I said earlier, anecdotally, I've seen it, I've heard it, I believe people's stories. I would like to go back to the science-based analysis. I'd love to see that modeling. I'm not following, I don't know what we're doing in that department, but as evidence here, it seems to have helped a lot of people. And so I'm impressed by that, and that's why I think we need to take a more cautionary approach. But in the 50s or 40s, when people started to smoke a lot, we didn't have evidence then. And we didn't until, 63 or 64 Surgeon General's report that it causes cancer. And, see how far we've come, but still how much further we need to go. I don't know what the long term will look like for vaping. But for now, if it's getting people off something that's causing cancer, I think it's something that needs to be embraced and regulated.
I think this is where I've come into this whole argument around harm reduction. So, and this is even in the medical community and in the public, this is a term that's poorly understood, and that we're trying to encourage people to do something that's much safer for them. And I don't know, there's still some skeptics, but there's people who are skeptical about climate change. So, but it's very hard to find any serious person who will say that vaping is as dangerous as smoking. And the bar is set so low. We've had a massive international study of what smoking does to people, and it's pretty seriously bad. So there's just no possibility. It makes no sense that if we follow a cohort of vapors for 10 years, they'll have anywhere near the health issues of tobacco. I mean, I'm okay with precaution, but that's just ludicrous thinking that somehow we have a product that delivers nicotine and eliminates 4,000 chemicals that are killing people, that somehow this will come out even. I mean, so this idea that we don't know enough about it yet and we have to be very precautious is, to me, ludicrous. In the stakes are so high, there's 4.5 million Canadians who could potentially benefit from this, and to say with a straight face as a public health official that, well, you know, I'm not quite sure, we have to wait, like it really, this is an opportunity that kind of argument is just absolutely ridiculous. I think that we should certainly monitor people. There's tons we need to know, and people that are vaping want to know what it's doing to them. So there's no concern, or there should be no holdback that we really want more information. But to be that precautionary that we really want to treat these as cigarettes until we have, you know, a 30-year cohort study, to me is just ridiculous thinking.
Well,
and
I
we
should
need to-
clarify,
yeah.
when I was saying precaution, I'm saying
Yeah.
not to put those restrictions on it now,
Yeah.
because it's working now.
Yeah, we have to
But we
go
take a
for it.
precaution and do that report and do the analysis.
Yeah, so we have to go for it. But the harm reduction, you know, if I step off this step, I could twist my ankle because I'm going down 1.5 feet. But if I jump off a 20-story building, I'll probably kill myself. And that's kind of the closer analogy to the risk of vaping. So we need to be really go for this as an amazing opportunity in public health. And this could revolutionize our whole healthcare system if we could get a substantial number of Canadians vaping and off combustible tobacco.
Thank you. Doug, I see you trying to jump in there.
Yeah, well, like Mark, I've been involved in the fight against AIDS for many years, and I've never smoked tobacco, although I'm well aware of the fact that it's the biggest killer in our country, biggest cost to our healthcare system. But I remember back in the 80s when people were suggesting that, you know, forget about condoms, we should be closing bathhouses and we should be telling gay men to stop having sex with each other. That was really a realistic policy proposal. And what we realized at the time was, when it came to things like screening the blood supply or supplying clean needles or encouraging people to use condoms, even when we didn't have the proof that it was going to be 100% effective, or even if we knew that there might be some harm involved, or that there is harm involved from injecting heroin, but isn't it better to use a clean needle when injecting heroin instead of one that's been shared with 12 other people? And that is the sound direction that public health has generally taken, I believe, in response to HIV through the work of AIDS activists and healthcare providers like Dr. Tyndall. And it took us a long time to get people away from the idea that the answer was, you know, reactivating Bentinck Island as a leper colony off of Vancouver and shipping all of the AIDS sufferers out there. You know, now we've got to the point where we understand that when it's clear that you got something that's harmful over here, like HIV or tobacco,